Hi, I'm Dr. Samantha Hill, Ontario Medical Association President. Today is National Indigenous Peoples Day, a day created to recognize and acknowledge the significant contributions of Indigenous peoples here in Ontario and across Canada. I hope you are able to take some time to join the celebration, learn more about the unique heritage, diverse cultures, and inspiring accomplishments of the First Nations, Inuit, and Métis peoples. I'm honored to have Dr. Jason Pennington here to join me today, as well as a message from another of our colleagues, Dr. Kona Williams, to share their experiences. Here's Dr. Pennington.
Kwekwe Aturo. Hello and welcome to our circle of friends. My name is Jason Pennington and I'm a general surgeon at the Scarborough Health Network. I'm also the Regional Indigenous Cancer Lead for the Central East Regional Cancer Program. Most proudly, I'm a member of the Huron-Wendat Nation. Thank you for having me here to tell you a little bit about what National Indigenous Peoples Day means to me and how we can use some of these concepts going forward in building better relationships with Indigenous and non-Indigenous patients. So first of all, National Indigenous Peoples Day started as a day of solidarity, brought about by events such as OCA, which led to the Royal Commission on Aboriginal People. Then the residential school programs was investigated through the Truth and Reconciliation Commission. Next was Missing and Murders Indigenous Girls and Women. As you can see, there's lots of effects of colonization, and this has had a lot of impact on Indigenous peoples in Canada. We all must be making ourselves aware of these events, these commissions, and their recommendations to find ways that we can help improve our therapeutic relationships with Indigenous patients and to recognize the effects that colonization actually has on ourselves as healthcare practitioners and ways to help mitigate these effects in our therapeutic relationships. Furthermore than looking purely at colonization, we should make a celebration of Indigenous cultures and nations that have existed long before that time. These are thriving nations with intricate governments and social norms, with laws and justice systems, with actually quite advanced medicine in some cases. It was the Indigenous people at Stadacona that saved Jean Cartier and his crew when they got stuck there for the winter and started coming down with scurvy. They knew how to make the diagnosis and how to properly harvest and make the medicines to treat the condition. So you see, Indigenous peoples have had sophisticated sharing cultures from well before contact. And we've been wanting to share this knowledge with Western society and other newcomers to North America. That's the type of relationship we want to form going forward, not a paternalistic relationship, not coming for help from Western medicine, but to be forming true partnerships and true sharing, caring relationships. So if we can actually form a more equal and just relationship in our healthcare system, this will be one way to help break down some of the inequities that do exist in our system. So I ask you to come out and actually help celebrate these amazing cultures that have existed on Turtle Island since time immemorial. And just to think about ways that you can interact and learn about the Indigenous communities that are closest to the area where you practice and live. And you will find that this enriches both your life and makes better therapeutic alliances with your patients going forward. So, Siwink, thank you for joining me here today, and have a great National Indigenous Peoples Day.
Thank you so much for those kind words, Dr. Pennington. We certainly have a long way to go. I'm now going to share the words sent in by Dr. Kona Williams. She says, Gwegwe Antansi, a greeting to all my colleagues across Ontario. My father named me Kona, which is the Cree word for snow. I was born in a blizzard. My mother is Mohawk, so I've been affectionately called a Cree Hawk. Today we celebrate National Indigenous Peoples Day. I invite all of you to reflect on the relationships with Indigenous people, not only in your practice, but also in your communities with your learners and your Indigenous colleagues. Consider the current environment faced by Indigenous people every day and the healthcare inequalities that still need addressed. Connect with the land and remember the countless generations who came before you. Remember the Indigenous women and girls who died by violence or have never been found. Take a moment to look forward to the next generation and the ones to come. See the potential in their eyes and guide them in a good way. Recognize that racism is still prevalent in our healthcare system. This is not easy to do with both eyes open. Take some time to think about the last interaction you had with an Indigenous patient. Think about how we can do better as physicians. Take the time to listen. I will share something I learned from my father, who was an elder. When I had a particularly bad day as a medical student, he sat me down and said, "Yes, this is hard. It is meant to be. Because as a healer, you will have to understand how hard life can be for others in order to help them. But you have the strength of all of your ancestors behind you. Honor that strength. Move forward. They are with you." However you celebrate today, I ask that each of you take a few moments to understand how you, as physicians, can develop relationships with Indigenous people based on respect, trust, knowledge, and understanding. Remember how each of us got to where we are, and as my father said, move forward. We can do this together. Nyawan and Miigwech. Speaking again as Dr. Samantha Hill, I'd very much like to thank Drs. Pennington and Williams for sharing their stories and their words. They remind us all how much we have to learn from each other and the importance of a diverse, inclusive, and just society. Miigwech.